5 signs an elderly person may be in their final year. Are you noticing subtle changes in your elderly loved one? Changes that seem small but feel significant? Recognizing these signs can help you provide the best possible care and create cherished moments in their final chapter. Subtle changes often precede death in old age. These changes can be easy to miss or brush off as just getting old. But recognizing these signs allows for better care and the opportunity to create cherished moments. The goal is to provide comfort, dignity, and peace in their final stage. Understanding these signs helps you prepare emotionally and practically. It allows you to make the most of the remaining time with your loved ones. Unintentional weight loss is often an early telling sign. It can start subtly with looser clothes or a fading appetite. Losing weight without trying is rarely a good sign, especially in the elderly. This indicates the body is not absorbing nutrients efficiently. Muscle mass decreases and essential systems begin to slow down. The body struggles to digest food or process protein properly. This leads to muscle wasting and an increased risk of falls. It also weakens the immune system, leaving them vulnerable to infections. Pay close attention to their eating habits. Appetite changes are common. Elderly individuals may not feel hungry, their sense of taste may fade, and food no longer seems enjoyable. This can be frustrating for both them and their caregivers. Underlying medical conditions can also contribute to weight loss. It can be a symptom of chronic diseases or other health issues. Depression or cognitive decline can also lead to reduced eating. Forcing large meals may not help. It can even be counterproductive. Focus on comfort, easy-to-eat foods, and hydration. Small, frequent meals are often better tolerated. Pay attention if they're eating less, feeling weaker, or struggling to stay active. Their body is sending a message that needs to be understood. Consult with their doctor to rule out any treatable conditions. Deep, persistent fatigue that doesn't go away with rest is another key sign. Simple tasks that were once easy now feel overwhelming. This is more than just feeling tired after a long day. The body is conserving its remaining energy. Organ function begins to slow down, impacting overall energy levels. This fatigue can be debilitating and affect their quality of life. The heart doesn't pump as efficiently and circulation weakens. Muscles don't get the same level of oxygen, leading to weakness. A metabolic slowdown occurs as energy is redirected towards preservation. You may notice them sleeping more or needing longer naps. They may spend most of the day in bed or in a chair. This increased need for rest is a significant indicator. The emotional impact of this fatigue can be significant. They may experience frustration, embarrassment, or withdrawal. This can lead to a cycle of isolation that accelerates their decline. Understanding their limits, allowing them to rest, and making their days comfortable is crucial. Avoid pushing them to do more than they can handle. Focus on providing a supportive environment. Cherish conversations, create moments of peace, and support them in any way you can. Even small acts of kindness can make a big difference. Let them know you are there for them. Changes in thinking, communication, and interaction are also important to watch for. This can include forgetfulness, difficulty following conversations, or disorientation. These changes can be subtle at first. Subtle cognitive changes can happen months before death. They may have trouble remembering recent events or recognizing familiar faces. These changes can be distressing for both them and their family. The brain requires a steady flow of oxygen and nutrients to function properly. Weakened circulation and decreased oxygen supply to the brain can contribute to cognitive decline. This can manifest in various ways. Emotional withdrawal is another sign. They may lose interest in social interactions. They may become less engaged in activities they once enjoyed. This withdrawal can be a sign of deeper issues. The brain may no longer process emotions and engagement the same way. This can lead to changes in mood and behavior, such as irritability, anxiety, or detachment. Be patient and understanding. Meet them where they are, speak gently, and offer reassurance. Avoid correcting them or arguing with them. Focus on creating a calm and supportive environment. Be patient, cherish quiet moments, and focus on creating a safe environment. Reminiscing about the past can be a comforting activity. Share stories and look at old photos together. A weakened immune system makes them more susceptible to infections. They may catch every cold, flu, and small infection that comes their way. Minor illnesses may take longer to recover from. Simple wounds may heal at a noticeably slower rate. This is because the body's ability to repair itself is compromised. Pay close attention to any cuts, scrapes, or bruises. Repeated infections, such as pneumonia, UTIs, or skin infections, are common. Antibiotics may seem less effective than they once were. This is a sign that the body is struggling to fight off infections. Chronic wounds, such as scratches, sores, or bruises, may not heal properly. These wounds can become infected and cause further complications. Proper wound care is essential. A sudden decline in mental alertness is often the first warning sign of an infection. This can be a subtle change, but it's important to be aware of it. Seek medical attention if you notice any signs of infection. The focus often shifts from curing to comforting. While medical treatment is still important, the emphasis is on managing symptoms and providing comfort. This can involve pain management and other supportive care. Keeping them hydrated, their skin clean and moisturized, and minimizing stress is crucial. These measures can help prevent infections and promote healing. A comfortable and supportive environment is essential. Noticeable changes in breathing patterns and circulation are often late-stage signs. This can include breathing more slowly or shallowly. These changes can be alarming, but it's important to remain calm. There may be pauses between breaths or irregular breathing patterns. This is known as Cheyne-Stokes respiration. It's a sign that the body is shutting down. Weakened circulation can lead to cold hands, feet, nose, and ears. The skin may appear pale, bluish, or mottled. These changes are due to the body prioritizing blood flow to vital organs. They may experience more shortness of breath, even with minimal movement. This can be distressing and uncomfortable. Elevating their head and shoulders can help ease their breathing. Fluid buildup in the lungs can make breathing more difficult. This is known as pulmonary edema. It can cause coughing and wheezing. Medical intervention may be necessary to manage this condition. Keeping the room cool, using a humidifier, or offering small sips of water can help. These measures can provide comfort and ease their breathing. A calm and supportive environment is essential. Ultimately, the goal is to provide comfort, dignity, and the knowledge that they are not alone. Your presence and support can make a significant difference in their final days. Let them know you love them. We've discussed 5 key signs: weight loss, fatigue, cognitive decline, frequent infections, and changes in breathing circulation. Remember that these changes may not all happen at once or be obvious. It's crucial to listen to what their body is telling us. Pay attention to subtle changes and don't dismiss them as just getting old. Early recognition can allow for better care and support. Focus on making their remaining time peaceful, comfortable, and meaningful. This is a time to cherish moments and create lasting memories. Your presence and support are invaluable. Understanding these signs isn't about fearing death, it's about being prepared. It allows you to offer better care, make important decisions, and ensure they receive love and dignity. Cherish moments, share stories, and let them know they are valued. Your love and support can make a significant difference in their final days. Don't be afraid to express your feelings. Knowing what to expect can help you find strength, patience, and peace. This is a difficult time, but you are not alone. Reach out to family, friends, and professionals for support. If you've recognized some of these signs in your loved one, it's time to take action. Schedule a consultation with their doctor to discuss their care plan, explore hospice options for compassionate end-of-life support, and most importantly, dedicate quality time to create meaningful memories with them. Don't wait. Start today to ensure their final chapter is filled with comfort, dignity, and love. Share this video with others who may benefit from this information and subscribe for more resources on elderly care.